Health for March 16 to order, and if we could all stand and recite the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Larry, do we have any announcements?
I have no announcements.
I would like to note that we have prepared 2 letters, one for Dr. Curtis Lamp and the other for Dr. David Prescott, in honor of their service of long standing to the Radnor Township Board of Health. And I would ask that everyone sign the letter so that we can forward it to their attention. Again, thanking them for their tremendous service over these years. The minutes of the meeting of the Board of Health for February 17 were circulated to the committee members prior to this meeting, and I would ask that they be reviewed and any revisions, additions, or comments be provided. And if there are none, then motions be made for approval or revision.
Move to approve the minutes.
Is there a second?
Second.
All in favor?
Aye.
The minutes are approved as submitted. Larry, if we can have your health officer's report.
Yes, Mark. I'm not sure of whether or not the board actually approved the December meeting, the end of the year report.
If we did not, then perhaps we could take this opportunity. Was that shared with the board, Larry?
Well, at the last meeting, we did not have a quorum,
Right.
so we weren't able to do that.
Yes.
So,
Okay. But but that material was shared with the board prior to this meeting, correct?
absolutely, it was in the packet.
Then I would ask if anyone has any questions or comments to that prior report, if you could pose those now. Hearing none, if I could have a motion to approve.
So move.
Is there a second? All right, all in favor? The ayes have it, and the material that was previously provided to the board has been approved. Larry, thank you.
Thank you, Mr. Bullock. For the month of February, we inspected 17 food establishments. I would like to say that we do have a new food establishment in the township, which is Primo Hoagies. They were here once before, I understand, before I came 7 years ago, and they couldn't stay away. In fact, I think they're back in the same location that they were previously, which is on 362 West Lancaster Avenue. I'm not advertising, but I'm happy to see that we're still growing, and we have other businesses that are actually coming into the township as far as food establishments. We did our routine bathing place inspections, which is our year-round inspections, and we investigated 9 complaints. One of those complaints is still not unresolved, which is the last one that you see there, which is we have a resident who continuously allows their dog to defecate all over the township. And so we're working in that process to resolve that issue. I'm happy to see that Dr. Donato is here tonight. He originally was away speaking in the University of Wisconsin. Maybe he can tell us a little bit about that engagement. But he is here tonight. And we are in the early planning stages of 2 events. They have to have the approval from the Board of Commissioners, but we had meetings today with the annual Mainline Jazz and Food Festival, which is a pretty nice event, and the Willows Cottage Family Hoedown. They're proposed for later on, early in the spring. Under the health alerts and the updates, I sent the board 5 advisories that were sent out, and those were, I think I put a copy of those advisories in your packet. So ends my report.
Thank you, Larry. Any questions for Larry? Hearing none, let's move to the old business. And the EAC, John, Dr. Prescott was the representative of this board to the EAC. I assume we want to continue to have that connection. So I would, based on your thoughts related to that, I would ask if there are any members of the committee who would be interested in being the liaison between this board and the EAC.
I don't know if you want me to comment on that.
Yeah, if you can, if you or Larry can kind of give us a sense of how many meetings the EAC has or what their schedule looks like, so that folks on this committee can think about that additional time commitment. We don't want to impose too much on people's time, but if it's very important from a health perspective to have that connection.
Okay. Larry, do you have the calendar for EAC? They meet once a month. I don't have a date. I think Mary Ann's looking for that.
You have a calendar?
I think they meet the last Thursday of each month.
Okay, possibly last Thursday of each month. We can get back to all the members of the Board of Health on the exact meeting date and time before the, very shortly. So.
Yeah, I would assume everyone thinks that it would be good to have that connection still.
Yeah, I do, and I will volunteer to fulfill that role through the end of June of this year and possibly after that, depending on how that works out. And again, provided there's no conflict with any. Thursday is a good night for me, but it's another night there may be conflicts.
Well, if we can get the detail on that, the members of the EAC, and then the schedule of time, that'll help us address that. Thank you.
I actually found it in our own minutes. It looks like the fourth Thursday of each month. I don't have a time.
Well, thank you. We'll look forward to getting that information, and then Herb, if you can evaluate whether that makes sense for your timing.
Well, actually, as I've said, if it is a Thursday, then that's fine. There are no conflicts for me on a Thursday evening, so I can do that at least through the end of through June 30th of this year, and possibly in the fall as well. But I just can't foresee that right now.
Okay. Thank you very much. On the medical environment and health access, I had the opportunity to do a presentation before the Pennsylvania Bar Institute, along with Professor Barry Furrow from Drexel Law School, as well as the current U.S. Attorney for the Eastern District of Pennsylvania, and Dr. Hoffman. And we talked about a number of different issues related to healthcare, the rise in healthcare costs, most particularly. We talked about the current modalities in healthcare delivery and certain inefficiencies. It was interesting as I was doing my research, if you look at the demographics, especially in Pennsylvania, you have an aging population which is contributing dramatically to the costs in healthcare. Most importantly, though, from the literature, is not the rise in the number of 65 and above, but it's actually the number who are 85 and above, who are the most expansive population demographic in the country and the most expensive when it comes in terms of healthcare. And it was pretty fascinating how the healthcare delivery system is, at this juncture at least, not equipped to deal with that rising population. We talked a lot about the new stimulus package in Washington. Most importantly, the portion of that stimulus package entitled the Health Information Technology for Economic and Clinical Health, which spells high-tech in Washington. They always like something to create an acronym. In addition to providing approximately about $19 billion in funding for health information technology, it is going to standardize electric health transactions and hopefully create greater efficiencies in the healthcare system. It will create an Office of National Coordinator who will deal with issues from patient privacy and expanding and enforcing the privacy laws under HIPAA, which is the Health Information Portability and Accountability Act, for those who are keeping score on the acronyms. In any event, there are a number of different activities going on, both in Harrisburg and in Washington, regarding healthcare. As the President has indicated, he's looking to set aside somewhere in the neighborhood of $650 billion to revamp and reform the healthcare system. In the stimulus bill, there was a temporary increase in the Medicaid FMAP, which is the federal portion of the Medicaid payments paid to states. That's going to bring about $4 billion into Pennsylvania, which will help work through a number of different financial issues at the state level. So if there's any questions, hopefully I can respond to those. Hearing none, if we can move to Radnor Health Matters.
Well, to go back to the ongoing saga of trying to get funding for distributing this emergency preparedness material to all the households in Radnor Township. I've identified so far one promising avenue for that, and that is the Rite Aid Foundation. I don't know if the other members of the board got a copy of my email note on that, which highlighted some of their requirements. And I talked with John Fisher before the meeting with regard to the annual report and financial information, the IRS 990, and the tax exempt information, and he is graciously going to try to get me that information, and I expect to be able to circulate via email a draft of the proposal that would go to the Rite Aid Foundation before our next meeting, so that we can informatively discuss it at the next meeting.
Thank you. Any questions for her?
I have one other item. As noted at the last meeting, there's some hope that the studio next door to where we are now, behind that wall there, may be ready by April to begin using it as a studio to transmit programs, and we want to use that for Radnor Health Matters programs. My thought is right now that I would like to do a program this spring on Lyme disease, and so if anybody, if there's general concurrence on that, that's the direction I'm going to pursue. If anybody on this board knows of an expert in the area who can be interviewed and respond to questions, do a Q&A on that, I'd be happy to get that information.
Thank you, and it sounds like an excellent and timely topic. If anyone has anyone obviously in mind, please let Herb know, because I think it'd be important. Fluoride in the drinking water. To be honest, I'm trying to figure out where we've left this topic. So if anybody can help me out there, that would be very good.
If we are, if we would like to pursue it, I think that the next step is to speak to someone in Harrisburg. Because obviously with, they're talking about the different lines crossing and, you know, it's this township and that township. And I don't think that the different townships are going to offer objection to it. I think it seems that the reason that it hasn't been done is because it can't be done on a township by township basis. So I think an argument could be made to Harrisburg that it's a cost-efficient thing for them to do, especially if you look at the population of kids who are uninsured and or are being covered by a state insurance, what it costs to take care of their dental needs as opposed to what it costs per child, per family to put fluoride in the water. I don't think anybody can dispute it.
I guess the, and John, we look for your guidance here. The testimony that was presented, I guess safe to say, expressed a differing opinion on the issue. Some held some very personal views on the impact and efficacy of fluoride in the drinking water. So, on one area is the issue of the medical aspects of that, and obviously there are the folks that presented here have very serious concerns. However, it appears that at least the medical literature would seem to indicate that any of the potential risks are outweighed by the benefits of fluoride. The other aspect of it is the implementation, and what I guess I wasn't clear on from the material that was provided is kind of a real overview of how difficult it would be to implement township by township. I think that was kind of what you were talking to.
I spoke to the Aqua PA people after the meeting, and they led me to understand that from their perspective, it is not a difficult thing to do. It's just that they cannot separate it out by township by township. So if they're given authorization from Harrisburg that all of the neighboring townships are to have fluoride in the water, it's not going to be a big deal for them to do it.
But that would require consensus from neighboring townships, and what I don't know is where they are in the review of this issue. To do this by township specific, which is really the area that our commissioners control, as I understood it, it required putting valves and stop gaps in all of the piping, and really, I guess they didn't even know how many pipes were directly going into the township, and also then trucking in fluoride and having it somehow integrated into the system. So I guess from the township perspective, I was unclear on the implementation and the costs then to the consumer. John, I'd ask for your perspective on where the commissioners would like us to go with this topic.
I don't have an answer to that question yet. I think what we need to, the way I view this issue, it has three components. It has the medical component, which this board has its purview, and then it has the engineering and implementation component, which is Radnor-wise, and then the regional. So we need to look at what is the plan if we were to try to implement this just in Radnor. What would we need to do? And I did not get a chance to speak to Dan Malloy, our township engineer, on that issue, but I think we would need to get, because it is Aqua's system, we would need Aqua to put together a proposal of what it would take to do this in our township. If we look at doing this regionally, then we're looking at setting up some type of a multi-municipal authority that would be responsible for fluoridation. We do this for the sewer treatment, and Pennsylvania state law allows for municipalities to form these kind of consortium-type authorities. And I would imagine, you know, based on the engineering part of it, we would understand who the partners would have to be. You know, if we're not able to, in fact, separate the fluoridation out from the resource, from the region, then we need to know who the partners would have to be. And we could, you know, we can make some assumptions here, but I think it's best to find out from Aqua and our engineer to find out exactly what that looks like. I would imagine some type of a map showing the water supply from the different areas, and you know, and having an expert from Aqua and/or our engineer look at that and determine, you know, what the design would look like. So I guess you know, I think it's still a little premature to go to the Board of Commissioners per se. If I'm asking Dan Malloy just for information, I think he can probably give us some information. I don't know if Aqua's in a position, based on the Board of Health's relationship with them, to go forward with this and give us a proposal, give us some insight, give us some information.
Well, we did have the representative from Aqua here previously, and I guess my sense of that discussion was that this was a fairly difficult implementation on a township basis. I think that perhaps an approach would be to have Dan Malloy talk to whomever his counterpart would be at Aqua PA to kind of have engineer to engineer discuss the issue and perhaps then present to this committee. The other piece, as you noted, in addition to the engineering implementation, is the medical piece, and we've had conflicting testimony, and I guess I would, we're blessed with a number of medical experts on the committee here. I'm definitely not one of those. And I would inquire as to whether or not we need additional testimony, or is the committee comfortable with the information that we had to make a recommendation on the medical aspects of fluoridation?
Well, there are a couple of things with regard to that point, because in addition to the three aspects that John mentioned to this issue, I think there are at least two others, and they're closely linked. One is the public education aspect of it, and the other is the political aspect of it. I mean, there is a reason why we do not have fluoridation 100% across all of the counties and townships in Pennsylvania, and that is because people have chosen to listen to information, whether it's correct or not, that would lead them to believe that fluoridation in the water is harmful to them. I mean, we got a spate of information that Larry forwarded to us. I saw mine today. I don't know whether it was forwarded today, but that cites various articles, and those things have to be refuted. And at the same time, I think they're getting back to the political dimension of it. There has to be some way of getting to the legislature in Harrisburg to find out who are the movers and shakers there who are interested. Where does this wind up? I know that for years the Pennsylvania Dental Association has tried to move the legislature in Harrisburg in this direction, to no avail. And so there's a long way to go. It's not just, and I want to put quotes around the word just, because the other problems are formidable as well. But it's not just an engineering problem or some of the other issues that John mentioned, but there are issues of consequence that we have to deal with in terms of public education, which may have to precede any motion to any move toward political action, which ultimately will be what's necessary.
If I might say, on the other hand, all of Philadelphia is fluoridated. So clearly Harrisburg didn't have any objections.
Well, that's because Philadelphia is a city of the first class, and they can make those decisions for themselves under their home rule charter.
Well, I can also say, from having practiced on the main line, that first of all, patients who would come in and find out that the water in this area is not fluoridated were shocked. They all assumed that it was. The other thing is that they almost categorically, kids were put on fluoride supplements by the pediatrician before I would ever see them. So I did not see, as a practitioner, I did not see a lack of support for water fluoridation. And of course, my experience is anecdotal. However, I did used to live in Allentown, where there was also no fluoride in the water, and the population had a very different sentiment than what I'm seeing here. So I do think that this is a well-educated population. In general, people are in support of fluoridation. I think the fact that we did not have a massive turnout of people anti-fluoride in Allentown when we began hearings for fluoridation, there was almost standing room only, people, screaming and yelling, and I mean, it was a really different experience. So I do think that that this area, in general, tends to be aware and savvy with respect to the benefits versus the.
Well, I think
And yet the fact remains, and I'm sure you know this better than I do, that the Pennsylvania Dental Association, despite many years of effort, has been unsuccessful in swaying the legislature in Harrisburg. And I don't know, I would assume you're a member of that body, and perhaps you can find out for us, what is the association doing now? Have they abandoned their efforts? Are they continuing?
I can find out.
Thank you.
I think it also comes down to us being an advisory board. And we have to look at the peer-reviewed literature. I hate to say in that email earlier today, much of it was not peer-reviewed. So I feel like step one, before any of this occurs, is we need to, as a group, decide if this is even worth recommending or not. Doesn't matter on cost, doesn't matter on any other factors. Medically, is it a good idea? And I think we should focus on that for the moment and then come back to the next steps.
I would agree with Doctor's approach. We are, first and foremost, an advisory board, and if we can provide the best guidance to the commissioners on the medical aspects, the other pieces, which John and Mr. Malloy can provide us vis-a-vis engineering issues, implementation issues, because again, we're focused on Radnor Township. Advocacy to Pennsylvania, that's a different venue than I think we're looking at, and perhaps that's something the commissioners may want to take up ultimately. As for the cost aspects of it, Pennsylvania is facing about $1.5 billion deficit, so I don't know if there's any new cost proposals that they'll entertain, but that's for others to that's for others much wiser than I to decide. But again, I think, Len, if we can follow your guidance, and let's look at the material that's been provided. I have not seen the email, and let's look at the peer-reviewed literature, much as we've done in other cases where we've only viewed the peer-reviewed material, and then make a recommendation on the purely health aspects of the issue, perhaps with some guidance from Mr. Malloy on the engineering and cost aspects of it, and then we can provide whatever recommendation to the commissioners.
I think in terms of doing that, I wonder if we could, and also to sort of get it on the record, if we, for our next meeting, and I'm going to ask you to take the leadership on this, to try and come up with a fairly succinct statement of these are the major issues, and this is, to the extent that there is controversy, here's what the controversy is, and here's an analysis of that controversy. And I think all of us are responsible for doing some reading to be prepared for that discussion, but I think if we can get that in the minutes, and then, I mean, there certainly have been other issues that, in terms of, trans fat, bus emissions, there have been smoke-free environments. There's certainly been other issues where we have taken on looking at something, while not specifically requested by the Board of Commissioners, but a health issue that we feel is important to residents of Radnor Township. So I think, this certainly is at least as important as those. So I guess that's my suggestion, to try and move this forward.
I think that's a great concept, and perhaps, Lawrence, if you can summarize that for us, that would be very helpful from my perspective. And ultimately, the answer may be to the commissioners, one, here are the health issues, here are the areas of controversy, and here are the recommendations, but also, again, keeping with the concept of what is within our span of control, it's the education piece on, okay, the water is not fluoridated, so what should people be doing as a response to that in order to promote their own health and the health of their children?
Well, right now, people are getting that information from their physicians or their dentists. So it requires, from a financial standpoint, it requires a doctor visit because fluoride is a prescription. You cannot get it over the counter. So, from a standpoint of cost to the residents, it's one less trip to the doctor.
And depending on where you go to the doctor, if your doctor is in Philadelphia and they're unaware of your address, or unaware that your address is located in an area that has no fluoride in the water, they may overlook, and I've seen this happen many times, writing a prescription for tri-bifluor. And then, like you say, the people have to go out and fill it and administer it daily. And as you have a few children, that becomes burdensome.
Also, from a practitioner standpoint, it makes it very difficult when there are some areas that are fluoridated and there are areas that are not. You have kids who live in a house that does not have fluoride in the water, but potentially go to school where the water fountain water has fluoride in it. So the lack of consistency makes it very difficult for people to know whether they should be supplementing or not. So I think, consistency is something that would be helpful.
Well, thank you. And I think that, again, it's an important issue, in keeping with Len's admonition that we focus on the health aspects. If we can get that summary, I think that'll help crystallize the issue, and then we can look at, one, what recommendations can we make to the commissioners? Two, what can we do from a health promotion standpoint, absent having fluoride in the water? And then three, John, if you can have maybe Dan do a presentation after a discussion with the Aqua PA folks. Great. New business, it's election time. Oh, I'm sorry, I missed that. Meningitis outbreak. Amy?
There are a couple things happening with meningitis, and also, one of them is that there was a case of meningitis in a University of Pennsylvania student. And actually there have been a cluster of cases at University of Pennsylvania, and those cases have been meningococcal meningitis, and they have been, due to a strain actually not covered in the meningococcal meningitis vaccine that we have in this country. So, of course, Penn has been great about giving antibiotics, preventive antibiotics, to people around those cases, to a good portion of the student body, and encouraging everyone who isn't immunized with the recommended meningococcal meningitis vaccine to receive it, because, that's, although not directly related to the cases happening at Penn, it's a opportunity to do public education, because meningococcal meningitis is, such a scary disease, because it's very rapidly progressing and can be fatal, and if not fatal, can leave the person with a lot of really severe and permanent disabilities, loss of limb, deafness, other things. So that's one thing that's happening with meningitis, and kind of the take-home message from that is for adolescents and college students to get their recommended meningococcal conjugate vaccine, which is recommended starting at age 11. So that's one thing. The second thing is Haemophilus influenza type B meningitis. So entirely, the word meningitis just means inflammation of the meninges, or the lining of the spinal cord and brain, which can be due to a variety of factors. So here you have meningococcal meningitis it's occurring in older people, and then meningitis due to Haemophilus influenza type B, which generally strikes very young children. And there have been 2 fatal cases of Hib meningitis, or Haemophilus influenza type B meningitis, occurring at, fatal, one to a 2-year-old, one to a 4-year-old in Philadelphia, both members of a religious community that does not believe in vaccination or other health care. And so these 2 children who died, both died of a preventable cause. And with Haemophilus influenza type B, the vaccine for that, there is a shortage of it. And so the recommendation, which normally is a series of 3 shots plus a booster, the recommendation now for providers is to only be giving those first 3 shots. And there have been a cluster of Hib deaths in Minnesota. So there are, not occurring among people who have been partially vaccinated. So there's the situation with that is that you're looking at people who are refusing immunization, and also at a shortage of a vaccine. But these deaths are not, the question about whether the deaths in Minnesota are related to the shortage, that is still unresolved. The ones in Pennsylvania have not been, because these are kids whose families refused immunization. So that's one thing that's happening with meningitis. I wanted to, if I could, also talk about a couple of other vaccine immunization-related issues. One is influenza. There is our first death from influenza in the pediatric population in Pennsylvania occurred just recently. It's a 15-year-old unimmunized, electively. It's a sort of really unfortunate combination of circumstances. The school that this child attended did offer a flu clinic. The child lost their completed consent form, did not receive the vaccine at school, and one of those things that fell through the cracks, they did not get around to getting their flu vaccine. So, previously healthy kid, preventable disease. Just to, we're kind of right in the middle, or hopefully near the end of flu season, but it's certainly not over. Just to kind of put it in perspective, last year in Pennsylvania there were 4 pediatric deaths from influenza, 3 of whom were in children who had not been immunized and who could have been immunized against flu. In The flu miss clinics we had in Radnor Township in the middle and high school, this year we had 37 kids in the high school get it, decide to receive it at school. And in the middle school, I have it here somewhere, 22 kids in the middle school got it, which is slightly fewer than last year. And of course, we don't know how many kids got it from their pediatrician, family physician, or other source of care. But when I talk to physicians to ask, are they capable of meeting the expanded recommendations that every child 6 months through 18 years of age receive flu vaccine, except for one pediatrician, pretty much the other 20-some who I've talked with around the state all say no, they can't, that logistically they just can't see how they can immunize every single one of those kids every year in relatively that short few months of time that you have to immunize. And so I think, this year the recommendation from the Centers for Disease Control and Prevention, the CDC, was to immunize 6 months through 18 years of age if you could. Starting next year, it is a recommendation to do it. So it's no longer, it's sort of a little stronger recommendation for next year than for this year. And I think, not that many people took advantage of it at the schools, so I think it's a question, I'm not quite sure what to do about that, whether to say, yes, we should still, urge the schools to offer it. I mean, I ideally would like to see some way that we're more proactive, that we provide a stronger, recommendation, or that in some way we're more visible about saying, yes, it's recommended. This, as I understand it from the State Health Department, they're not going to be offering, they had some special funds that they were able to offer some free flu vaccine to schools last year, which we could have taken advantage of but didn't for a variety of reasons. But that is not going to be the case this year. So we're looking at, urging people to go to their usual source of care, their medical home, to get their flu vaccine. That, of course, is the first choice. Offering it in school for a fee. The reason that we would hope people would take advantage of that, or the incentive, would be its convenience, that you could get it right at school. In the past, we've only offered the flu mist, the intranasal, the live attenuated influenza vaccine. That is not recommended for pretty much everybody who's high risk, which includes kids with asthma, and a lot of, any other chronic health or lung condition. So in a way, you're missing the highest risk kids if that's all you offer. The company who has provided it for us in the past, Maxim, is quite happy to also offer the injectable vaccine, which is recommended for everybody, although neither vaccine can be given to someone who is truly egg allergic. Both vaccines are grown in eggs. But other than that one true medical contraindication, there are no other medical contraindications to the injectable vaccine. Now, the reason that has not been offered in the past is the school nurses were uncomfortable with needles and injections being given at school. As I said, the company that has provided the service for us in the past, Maxim, is happy to provide it, either or, both, vaccines. So I think, it's kind of, is there something else we want to do, or do we, or do we want to
Can we supplement the nurses with some additional staff, even if it's volunteers who are able to give the injections, so that we don't miss the population that is most at risk?
Mainline Health has offered us nurses. The thing we ran into was a problem about who could write standing orders for them. I was unable to find a source in Mainline Health to write standing orders for them. I was hoping that Dr. Hobson might be able to, sort of help out with finding who would be the right person to do this. Because we had the option last year of having nurses, free vaccine, and we didn't take advantage of either of those things. And we could have done the elementary schools too. We could have done elementary, middle, and high schools.
Now, is this only the public schools?
that's all that we have done, you know, that's all. Anyone is free to contact this company and have them come in Lower Merion. I know they have gone to private schools, Haverford School, Akiba, Baldwin School. So there's no reason anyone couldn't arrange. It just happens, you know, that it's just sort of happened that way. I mean, you know, partly because my two kids are the middle and high school, so I knew those nurses. But it's very easy to arrange. There's no reason it couldn't be done.
How about
And these
parent
nurses
education?
actually work partly in the private schools. You know, these are nurses that are, I'm not sure who their employers are, but they work both in public and private schools. So, you know, school nurses, and the state health department has notified, you know, every school nurse about these kinds of programs.
How much information was provided to students and/or parents about the vaccine being available?
It was in the, you know, the information that came out from the school saying that it, you know, that these clinics were going to be available. I mean, it's on my to-do list to go to a PTO meeting and to provide more information through that venue to see if that makes a difference.
I think it would, and I think, you know, I think a lot of, since the recommendation has changed, and previously it was only the at-risk kids who were recommended to be vaccinated, and there's still some misconception about the flu vaccine. I think that it would be helpful to provide more information to parents and be more encouraging to them to get their kids vaccinated.
Amy, were you, for the prior 2 years, were you surprised by the numbers?
Yeah, I was surprised. I mean, I think because it doesn't have a, you know, sort of an in-school advocate. The school nurses, I think, they've sort of said, yes, it's okay if this happens, but they haven't taken it on. They haven't, you know, in some schools, like, they do poster contests, they do, you know, they really sort of talk it up. And, you know, it just isn't something that has sort of taken off here.
Because I mean, the numbers, the raw numbers just, I have no basis to say this, they just sounded low, the raw numbers, given the population. And I was wondering if there's any possibility of connecting with the school board on this issue and perhaps promoting it through that avenue.
Well, I think that's a good idea, but I also think it would be interesting if in all schools, not just the public schools, if you could get a group of student advocates to help spread the word to their class. That often works well when you're dealing with, you know, issues that kids will take home the information to parents who are otherwise unaware. And adolescents tend to be in between pediatrics, adolescent medicine, and internal medicine, and tend to drop off the map for a while after a certain age for regular doctor's visits. So I think that's something that, you know, a responsibility in the sense of, you know, awareness of health is something that's currently getting to be more of an acceptable thing, taking ownership for your nutrition, for your exercise, and, you know, for what you need to stay healthy. And I think that could be a grassroots thing that could work on all school levels.
I mean, I think those are great points. I did, just to go to the school board, I did notify, I mean, I was in touch with the school board and did make sure they knew that this was happening, and, you know, so I did do that. I mean, it's one of the, you know, I should go to a meeting and talk about it. In terms of kind of what to do to develop more of that student ownership, I mean, you're absolutely right. I mean, missed opportunities occur either when a kid comes to a office for a sick visit or an injury or something else, and that opportunity to immunize isn't taken advantage of, but also all those kids who don't come to the office for anything except You know,
Right.
maybe a sports physical, but a lot of them take advantage of that in school because it's real easy.
Mhm.
And
Even the
driver's
sick,
physical.
even the sick visit,
Yeah.
frequently they won't immunize them on a sick visit. So
Right.
it requires an additional visit. So, I mean, I think having the opportunity to get immunized at school
Mm.
is a great thing. I think we need to get the message out more to encourage people to let parents know that it is now recommended that all kids get immunized, as opposed to just the at-risk
Right.
population. And, you know, adolescents and teenagers being what they are, you know, if my best friend's getting the flu shot, well, I'm getting it too, you know, and, you know, everybody can get up from the lunch table and go to the nurse's office together, as opposed to, you know, I've never done that, I'm not doing that, it has nothing to do with me.
Right.
So I think peer pressure, peer awareness is very, very important. in
Yeah, I
age
think
group.
peer awareness is very important because I think you're going to reach everyone that way. And if you just get some people to have in their health classes, maybe take, I know that some of the private schools, they take on projects where they, you know, present, different people in the class present different health issues and what the position is for that. I mean, this is something that can be incorporated into the health curriculum even. But I think if you have that awareness and you have that opportunity, you're not going to miss as many people, especially if the person themselves understands what's at stake. And I think a lot of people have developed a prejudice against vaccines over the years, maybe in their parents' generation, and you know, may not be fully aware of what's out there. And I think we're also educating the next generation to take responsibility for the next generation. So I think that'll be good. You know, it would be a good rundown.
Well, thank you. I guess we'll leave it, Amy, up to you how you want to approach that. If we need a formal connection to the school board, John, if there's somebody who you think would be a good connection for us to bring this issue to light.
Well, I would imagine you'd want to address the entire school board at this point, because I'm not quite sure who the champion would be. I have the emails. The emails are on their site as well. It'd be easy to submit to all.
Well, Amy, if I can impose upon you to follow up on that. Okay, thank you. New business is, we touched on the flu mist clinics here, right, in that discussion. So the only other item then is election of the president and vice president. We have a nomination from the last meeting for Herb to serve as the vice president. That was also seconded, and I would ask for a vote. All in favor? Aye.
Aye.
So Herb, you're officially elected.
Thank you, and as my first official act, I'd like to move that we nominate by acclamation Mark Bullock to serve again as our president.
Seconded.
All in favor?
Aye.
Is this where I get to say nay? Or? Thank you very much. Is there any other new business before the committee? Hearing none,
I have one other thing. I know I had mentioned this once before, and I guess I'm not quite sure where to go with it. In the middle school, public middle school, where they don't have any athletic fields and not sure exactly when they will have any athletic fields, they have physical education for 1/4 of the school year because they have it for one semester, and that semester they have it for every other day. And it just does not make sense to me, and my kid, of course, happens to love gym, so. But it just doesn't make sense to me. Here we know, okay, obesity, and literally they sit in the cafeteria during lunch because there's no place to go, and that they don't even have, I just feel like somehow during this time where, especially during this time where there's no field space, you know, can't they have gym more? It just does not, and I guess I'm not quite sure sort of what the issue is. Is it the state requirement? I don't know. I can't quite figure it out. So I don't know if anyone has any thoughts on this.
Do they let them
There's no
do
place
activity
for them to go.
in the gym itself, like play basketball or
No, not during
volleyball?
lunch.
Really? It's interesting.
Is it a supervision issue? Or a liability?
There's no physical place to go. There's
Mm.
no, there's the cafeteria, which is crowded.
Mm.
There's this little tiny, just area, which is really the bus waiting area outside, where they can go and stand outside there. But
Which school is this?
the Radnor Middle School.
Mm.
And the fields are far from done,
Right.
very far from done.
When the fields are
And
done,
also,
are they going to have the
They're still not going to have
program
any more
extended?
gym. They still will only have gym 1/4 of the year.
And they rotate a quarter of the school through that? Is that what happens? Like, why
Yeah.
is it only a quarter of the year? Is it
Yeah, because you
time
have it for one
management?
semester, and that semester you have it for every other day.
Before they
That's
moved the
crazy.
school to the new location and did all the construction, is that the same scenario they had before?
I'm not sure.
Because I'm wondering if it's a curriculum issue as
Well-
opposed to a space limitation issue.
I think you're right, because I've seen this in a lot of schools, including private schools, that the push to get academics in during the day has pushed out any free time, recess, or physical activity at the very time when our kids are the most sedentary, exposed to the most junk food, and we all know what the outcome will be in years to come, and we're not setting a good example. This is another thing where the kids themselves are aware of the impact of this, and at least I know in my kids' school, they're unhappy with the not having the option to have some more physical activity. Plus, I think if you have a break and you have some physical activity, you might function better during the day, release some of your frustrations, and be more easily educated. So I think there's a lot of parameters that go into losing physical education. It's not like losing a elective ancient language or something. It's something you have to live with in your body the rest of your life. So
There's been nationally televised commercials about saving gym, so I don't know if this is necessarily just a Radnor issue, but
no, it's not.
I wonder if we do end up talking to somebody on the school board to really identify why, and that may be able to have us look for a solution.
Well, I'll contact Mr. Stevenson and just ask him, just sort of clarify
Sure.
the issue. Your point is good, Mark. What was it before they moved, and is it a curriculum issue?
It's it's either the curricula or it's space function, or it could be, do they have adequate showers and all the rest of it? Who knows what the rationale
Well,
is.
if it's a matter of there's no facilities, in the worst case, the kids might not necessarily love the idea, but they could always, in an organized fashion, make them go for a 2-mile walk in the neighborhood, there are ways to get physical activity without having a field.
Right.
It's well documented that it's just as good for your heart.
Plus, consistency is the thing, not just having a fraction, some part of your life, some part of the year. And, you're not going to take away good habits that way.
Well, maybe if you're talking to them, and you can follow up on that as well. All right, I think our allotted time has expired, so I appreciate everyone's participation, and we'll call the meeting adjourned.